So we've come to the point where we realize that either yourself or your loved one really does need some type of care. The next challenge we face is, how do we pay for that care? Hi, my name's Phil, and today we're going to discuss how to pay for care and what are our resources. What's important here is, if we go to a video that talks about the difference between home health care and home care, it would be good to look at that, because many times I hear people tell me, oh no, my insurance pays for this. And I know right away that's my clue, because what can happen is we're confusing home health care with home care. Home health care, it will be paid for. Home care won't. You have to find a resource to pay for it. So there are a few different ways to pay for home care. The first one is the most common one, which is private pay, where the money is coming right out of the client or the patient's pocket to pay specifically for the care that they're receiving. This is important for a couple of things. One is just that's the way we're going to find a way to pay for it. Or as we talk about Medicaid and the possibility for Medicaid, sometimes you need to spend down what you have to ultimately qualify for a government benefit. So when I say spend down, it's just important to understand that to qualify for most government programs, and specifically for the Medicaid program, you are only allowed a very small amount of an asset or money, and then also they take into consideration what your monthly income is. So if you have a large retirement, that needs to spend down to a point where the government says, okay, now you qualify for the benefit. So once we go down one more level in terms of what's available and what to pay and how to pay, one of the available things is long-term care insurance. It's very important to understand that long-term care insurance is not health insurance. Also, this video would be for people who already have long-term care insurance and have the ability to use it. If you need long-term care insurance to pay for this and you don't have it, unfortunately, it's too late to get it by now. So with long-term care insurance, what happens is you've paid into an insurance policy that says if you get ill and or disabled, this policy will kick in and pay for some or all of the care that may be needed to help you. The other thing to consider about long-term care insurance, there are some life insurance policies that have a rider attached to it that will allow for some of that life insurance benefit to be applied to long-term care. For more information on long-term care insurance, go ahead and check out our other video that's specifically related to long-term care insurance. The next options for paying for care would be government benefits. Typically this means Medicaid or VA. So with Medicaid, it's a program that is connected state to federal government, and every state has differing policies and procedures around what the benefit is. What you need to understand is the first thing that's going to happen is Medicaid will determine if you're eligible to receive the benefit. And yes, the benefit can pay for home care, and it also can pay for assisted living. When it comes to the assets that you have and what the government does to determine your qualification, what they're going to do is look at the whole picture in terms of your savings, your retirement, your property owned, and they're going to do what's called a 5-year look back. Okay, and they are going to determine at what point in time assets are going to dwindle to the point where you're qualified. So if right now today your assets don't qualify because there's too many, that's when the clock starts ticking. Now the other thing they're going to look at is, as you're spending down your assets, are you spending that on your care related needs? The other programs that are available are through the VA. So if you have spent time in the military, there are at least 2 programs that can be available to you. One of them is called the Homemaker Home Health Aid Program. The other one is called the Aid and Attendant Program. Both those benefits are wonderful benefits, and in another video we'll be able to explain more fully what that looks like. If you'd like to learn more, please visit alwaysbestcaretacoma.com.